Patient surge capacity and resource management serves as the foundational topic for Lesson 8. This session focuses on the critical systems required to handle extreme influxes of patients during disasters. We will explore how healthcare facilities maintain high standards of care when demand exceeds normal operating limits. Effective management involves a strategic combination of physical space, human personnel, and essential medical supplies. Throughout this discussion, we will emphasize the importance of pre-planned protocols that allow for a rapid and organized response to any large-scale emergency or public health crisis. Understanding patient surge capacity begins with the definition of surge capacity, which is the specific ability of a hospital to manage a sudden, significant increase in patient numbers. Emergency preparedness dictates that hospitals must proactively prepare systems to expand care capacity quickly to avoid system failure. Finally, efficient resource use is a core principle, ensuring that proper planning allows all available resources to be used effectively during surges. These three pillars ensure that the facility remains functional even under the most intense pressure of a mass casualty event or a spreading pandemic. Space management during surges involves several tactical adjustments. Expanding treatment areas means hospitals may use additional wards, hallways, or temporary external areas for patient care to accommodate the overflow. Prioritizing critical areas is essential, as emergency rooms and intensive care units must remain available for the most critical cases, while stable patients are moved. Flexible facility use allows for non-clinical spaces, such as cafeterias or waiting rooms, to be converted into functional treatment areas during emergencies. This spatial flexibility is vital for maintaining patient flow and safety during a crisis. Staffing and human resource management focuses on the people providing the care. Staff allocation involves the strategic process where additional staff may be reassigned from elective departments to critical departments. Extended work shifts are often necessary, meaning staff schedules may be adjusted to meet the increased patient care needs over long durations. Additionally, support teams play a role, as volunteers and non-clinical support staff may assist healthcare workers during large incidents. Managing human capital effectively prevents burnout and ensures that there are enough hands on deck to treat every incoming patient safely. Medical supply and equipment management is the logistical backbone of surge response. Ensuring adequate supplies requires that hospitals must maintain a robust emergency stock of medicines and medical equipment at all times. Efficient distribution ensures that these supplies should be distributed to specific departments based on real-time patient needs, rather than standard quotas. Equipment readiness is also a priority, meaning critical equipment like ventilators must be available and functioning properly before the surge hits. Without these physical tools, even the best trained staff cannot provide the necessary life-saving interventions required during a disaster. Monitoring and adjusting resources is the final stage of active management. Continuous situation assessment requires hospital leadership to constantly monitor patient numbers and resource use to stay ahead of the curve. Adjusting resource allocation means that staff, space, and supplies should be reassigned dynamically as the situation changes throughout the event. Maintaining operational efficiency is the ultimate goal, as ongoing monitoring ensures effective patient care is delivered consistently during disasters. This iterative process allows the hospital to remain resilient and responsive until the surge eventually subsides and normal operations can resume.